Patrick Commiskey in Albuquerque, New Mexico. This is a patient with radial keratotomy who has fluctuating vision, morning to afternoon, not really able to tolerate a hard contact lens, and is just really struggling with achieving any kind of clarity of vision with or without a contact. So we're actually doing a full thickness cornea transplant. Here the eye has been completely anesthetized by a retrobulbar block beforehand. And here you can see we've trephinated the cornea, and we're using these specialty scissors to kind of finish all the way around. Now that's the brand new cornea there from a donor, and the most important sutures are these first four to kind of get the eye closed up in a timely fashion, but also to set ourselves up to have as little astigmatism as we can. So these first four are very important. I use visual landmarks rather than markings. So you kind of look by the creases in the cornea, and then you're subdividing the different sutures. So we kind of go all the way across. You can see in this particular graft on the right side, there's a little bit of haze to the graft. But overall, the graft looks quite clear, and that haze usually clears up by about a week. Having a full thickness cornea transplant is quite a commitment for the patient and the surgeon. It takes a long time to rehabilitate the vision after a full thickness cornea transplant. Typically, we don't refit the patient for a new pair of glasses or a new contact lens until at least 3 months after the surgery. We leave the stitches in for at least a year after the surgery. Now, they're not scratchy for that whole time, but you do have all 16 of these stitches in the eye. And then if you're going to have cataract surgery afterward, well, we have to wait at least 6 months. Or really, if you want to wait longer, we'd wait until we take out all the stitches, then get new measurements, and 3 months after the stitches are removed, and then go from there. So it's a lengthy healing process, and you're always going to have the cornea transplant there, so there's always certain risks associated with the full thickness cornea transplant, like infection, rejection, and traumatic dislocation if you hit the eye with enough force at the right angle. So it's something that we really undertake after a serious conversation and after the patient has already tried to use a scleral contact lens, which is a type of hard contact lens that can provide an artificially smooth surface to the eye. So I have patients kind of go through quite a bit before we decide to do a full thickness cornea transplant. But here's how we do it. When we do it, and make all these stitches all the way around. So in there, at the very end, you bury the knots. So that's kind of what you do at the very end. Bury the knots. All right. Well, I hope this was an interesting video for you. It's not a surgery that happens a lot, but we might do 50, 100 a year, something like that at Eye Associates. So that's what it looks like. Thank you for watching.